You're too noisy for me. I'm kidding. I'm too noisy for you.
That's fine. What are our norms for supination?
30 to 35.
30 to 35, and then pronation is?
15 to 20.
20! There we go.
25,
I heard the first number,
15 to 20.
25, but then it trailed off.
30 to 35 and 15
30 to 35 for supination, 15 to 24 pronation, okay? So, with supination and pronation, these are fun-ish, okay, for a couple reasons. Supination isn't too bad. However, pronation, because of the fact that we're going up into dorsiflexion and where we place the goniometer, you have to be aware of what's going on and how you're moving the goni to decrease the possibility of possibly cutting the patient. Everybody in here has nice, healthy skin. It's when you are starting to measure somebody that doesn't have healthy skin that we can cut it. But we'll talk about that here in just a little bit. So first, we'll talk about supination. Supination, again, if I were to just take her through the motion, plantar flexion, adduction of the forefoot, and as I do that, you don't necessarily have to worry too much about taking care of that inversion because we'll actually measure that one. But essentially, I'm going to push her into plantar flexion and then take her into adduction of the forefoot. Okay, and that's the position I want her in for supination when I measure her. Our fulcrum obviously is not going to be on the side of the foot because, well, if I do that, then I can, yes, get the plantar flexion, but then I can't really get and integrate that adduction motion in there as well, right? So, as far as measurement goes, we're really only going to be measuring when we come into adduction. That's what's going to give us our number. Our fulcrum, if we look in between the two malleoli, there's a nice little soft spot, almost a little indent on pretty much all of our patients. And that is going to be our fulcrum, okay? We can follow the crest of the tibia, and that's going to be our proximal arm, and then our distal arm is going to come down in line with the second metatarsal. Okay? And she's not at 0. I don't have to worry about bringing her back to 0 to start her. I just know that that's where I start as far as my documentation, where my numbers start, okay? So, I'll push her down into plantar flexion, but then I'll bring her into some adduction there. And that's going to be my number. Now, if I let go, it's still stuck on the toe, and so it's not going to be able to stay there very good. So with this one, you want to put them in that motion, get your measurement. She's got 30 degrees, and I let go. Okay. For pronation, because I just did supination, this is where the possibility of hurting your patient or cutting your patient comes into play, okay? Because I know that the motion is dorsiflexion and then abduction, up and out like this. Okay? Now, if I have my proximal arm on the bottom in the wrong direction, so now it's like pretending to be my distal arm, and I bring her up into that position, as I move, the numbers on my proximal arm is going to move with it, and that's where I could get some possible cutting going on. And I want to avoid that, okay? So just make sure that when your goni is lined up, the one with the numbers, which is your proximal arm always, is actually your proximal arm, okay? So now I come up into dorsiflexion and come out into abduction, and I'm getting you're right. I'm getting 30 degrees on that one as well. Okay. what was I gonna say? Oh, make sure sometimes as you do that, your goni will push itself out like that. Now we're not lined up anymore, right? And it's saying that she's got like 70 degrees. Holy crap, that's whoa. You know, we don't want that. That's not correct. So we want to keep that fulcrum at the joint as much as possible. Actually, I must not have been. Oh no, I'm off the second toe again. So as we stay on that second toe, and we line it up just right. Yep, still getting 32, 30, 30, 30 degrees. Okay. Any questions on supination and pronation?
What is the axis on again? Just between the medial.
It's between the two malleoli, sitting right between them, and essentially you're at the talocrural joint itself, as far as that axis goes. But there's a nice little, if you find the two malleoli and then go in right in the middle there, there'll be a soft spot, and that's essentially where you're going to be lining up that fulcrum.